Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner. October is Breast Cancer Awareness Month. Breast cancer and other cancers affect everyone, whether it's your mother, your sister, your aunt, your grandmother, your coworker, your best friend, or your neighbor. Cancer is no respecter of persons or even gender. Today, we want to raise awareness specifically about breast cancer and focus on the importance of early detection. About 1 in 8 women in the United States, or about 12% of all women, will develop invasive breast cancer sometime during their lifetime. In 2016, almost 250,000 new cases of invasive breast cancer are expected to be diagnosed across the country, and over 40,000 will die from the disease. These are pretty sobering statistics. Thanks to the American Cancer Society and dramatic improvements in cancer research, treatment, and early detection, millions of women are surviving breast cancer. There are more than 2.8 million breast cancer survivors in the United States. And I can't emphasize enough that early diagnosis and better treatments have really improved survival of people diagnosed with breast cancer. And that's why it's so important to do the early screenings and the mammograms. After increasing cancer rates for about 20 years, breast cancer incident rates in women began decreasing in 2000 and actually dropped by 7% between 2000 and 2003. This large decrease was thought to be due to fewer women using hormone therapy after menopause, after some results were published by the Women's Health Initiative in 2002. In fact, death rates from breast cancer have been declining since about 1990, and that's certainly good news, according to statistics put out by the American Cancer Society, with women younger than 50 years of age showing the largest improvement. A very interesting statistic is that breast cancer risk is almost double among women who have a first-degree relative, such as a mother, sister, or daughter with the disease. However, it is important to stress that 85% of women with breast cancer have absolutely no family history. And we are seeing it can happen to women of all ages, so even if you're in your 20s, you still have to be vigilant. Many women over 40 who do not have a family member affected by breast cancer think it's okay to skip breast exams and mammograms, and I think that's just alarming, because most women who get breast cancer do not have a close relative with the disease and would certainly have a better outcome with early diagnosis. Another interesting fact about breast cancer is that there may be many new cases of invasive breast cancer diagnosed in men this year. So what can be done to prevent breast cancer? Well, we know of no sure way to prevent breast cancer, and we know that some risks, such as family history, can't be changed. However, the Mayo Clinic says that there are lifestyle changes that can lower your risk, even if you are a high-risk person. Lifestyle changes have been shown in studies to decrease breast cancer risks for everyone. These include limiting alcohol, not smoking, controlling your weight, being physically active, breastfeeding your children, limited dose and duration of hormone therapy, and avoiding exposure to radiation and environmental pollution. Now, that list is really good advice in general for good health, and will have broader health benefits. So these are things that can reduce your risk of breast cancer and can probably keep you healthy as well. But most important is regular self-examinations and getting that annual mammogram, particularly if you're over a certain age. So there's something we can all do in this battle against breast cancer. Breast Cancer Awareness Month is a good time to learn more about how to prevent and detect cancer and learn about resources that are available in our community. So I'd like to read the proclamation. Whereas in 2016 alone, an estimated 4,880 Maryland women will be diagnosed with breast cancer, and approximately 820 will die from the disease, making breast cancer the most frequently diagnosed form of cancer in women. And whereas every woman is at risk for breast cancer, even if she has no family history or other risk factors for the disease. And whereas screening and early detection of breast cancer is essential to the well-being and health of Maryland women. Through the Frederick County Health Department Breast and Cervical Cancer Program, 384 women received clinical breast exams, cervical cancer screening, and mammograms last year. And whereas research shows that screening mammography can help reduce the number of deaths from breast cancer among women, however, only 56% of Maryland women report receiving a clinical breast exam and mammography within the past year. And that's certainly a disappointing statistic. So part of our message is to take a few minutes and go out and have your mammogram. Whereas Frederick County is pleased to join with the Department of Health and Mental Hygiene to encourage women to learn about their risk for breast cancer, talk to their health care providers about recommended breast cancer screenings, and to be screened with clinical breast exams and mammograms as appropriate and advised. Now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim October 2016 as Breast Cancer Awareness in Frederick County, Maryland, and commend this observance to all of our citizens. Now, I have some very important people with me here today who I'd like to take a few moments to introduce themselves and share a little bit of information.
Good morning. My name is Elizabeth Chung. I'm the Executive Director for the Asian American Center. It's very wonderful to be here with all my colleagues and promoting breast health. And we do have an event that you can learn more about. Half of the women, as executives said, that have not had a mammogram and cell breast exam. So we encourage everyone to do so.
I'm Laurie Fry with the American Cancer Society, and the message I would like to share today is don't be afraid to get your mammogram. We have women who do have insurance that they will not go because they're afraid of the results. You can't fix what you don't find. I don't want to lose any more people in my life, so I am begging you, get your mammogram done.
Good morning, I'm Beth Mowry, and I'm here representing the Frederick County Health Department's Breast and Cervical Cancer Program, as well as our Cancer Coalition. I'd first like to thank Jan Gardner, our county executive, for having us all here in recognition of October being Breast Cancer Awareness Month. At the Health Department, our breast and cervical cancer screening program serves women who don't have insurance or who are underinsured, who live in Frederick County and meet our income guidelines. So if you are a woman out there in need or in lack of resources in order to get your cancer screening, please contact our program. We are here to help. I want to show our brochure that does have our phone number on it, which is 301-600-3362. And you can also access our website. Thank you.
And I'm Christine Palkowski. I'm a community health educator at the Frederick County Health Department.
And I'm Erin Conto. I work with Community Radiology. I'm in sales for them, and I'm also a board member of Team Hope that's in Frederick. My main job is to go out to a lot of the doctors and ordering providers in the community and just, spread awareness so, they're educated so that they can, relate things back to their patients. I feel like it's a great opportunity for me to be a part of so many different, organizations, because there is a lot of outreach programs for people who do not have coverage, and I think it's a great thing. So, thank you.
Good morning, and once again, thank you so very much, County Exec Gardner, for taking time today to acknowledge October as Breast Cancer Awareness Month. My name is Angela Spencer. I'm the founder of an organization in this community called the Faith Striders. Faith is fighting against illnesses through Him. 10 years ago, I was just sitting here thinking, is when my best friend in Texas, who played tennis, who didn't drink, physically fit, everything in life, just perfect health, found a lump, and she was diagnosed with breast cancer. And I was able to walk that journey through with her and to learn more about breast cancer and what we need to do as women. So with that, that's how the Faith Striders were founded. But over the past 10 years, we've made over $100,000+ in donations to multiple organizations to aid in research. And by your stats that you just gave, it lets us know that we're doing a good thing. But the one thing about the Faith Striders, we want everyone to be aware. And we do what we do because we care, simply because we care, because everyone needs an advocate and everyone needs a voice, and that's who we are for our community. So if you need us, y'all know how to find me one way or the other, or a Faith Strider. But remember, we're fighting against illnesses through Him. And for the month of October, wear something pink. Think pink, because as she stated, cancer is no respecter of persons. My mother is a survivor, and I stand today because of her.
Good afternoon. My name is Sandra Dorsey, and I'm a member of the Face Striders. Breast cancer to me is a hard thing because I know many members of families and friends who have lost this battle and who have survived this battle. So anything that I can do to help anyone, I am here. And I think I've been a member almost now 7 or 8 years. Yes.
Dedicated.
Thank you.
Thank you. My name is Graciela Vilasis. I am working in Asian American Center of Frederick. The more important for me is to involve all the women. It's something like all the persons said, don't be afraid, go to take mammograms because it's very important, especially when we have family. I don't like to see the child crying, you don't have my mommy with us. Taking care of yourselves. This is the more important for us.
Hi, my name is Ashley Bennett, and I am the health program specialist and a community health worker at the Asian American Center Frederick. I just want to reiterate what everybody else said, which is that education and early detection are very important. At our health fair on October 22nd, we're going to be able to provide free clinical breast exams and coupons for free mammograms for anybody who qualifies. If you don't know if you qualify, come anyways, and we'll let you know. Like somebody already said, you can't treat what you don't know is there.
Okay, do you want to share about information about the health fair in Spanish?
Vamos a tener en octubre 22 la Feria de la Salud. Va a comenzar desde las 8 hasta las 3 de la tarde. Quedan todos cordialmente invitados, totalmente gratis. Tienen exámenes de salud, de visión, de oído, tienen mamografías, en fin, una variedad de servicios médicos. Por favor, asistan, es muy importante, no tengan miedo, es totalmente gratis.
Thank you very much. We really want to encourage all women to take advantage of the opportunity to come to the health fair on October 22nd so that they can have access to screenings for breast cancer and for other health screenings because, as we said earlier, good health in general is good. Now, I do want to thank everybody here for all you do to help people in our community who have found themselves challenged with breast cancer or another type of cancer and to raise awareness about breast cancer. And it's really important for those of you who are watching to talk to the members of your family about getting that important screening, that mammogram, and to pay attention to their own bodies. I do want to thank people in our community who are working on research for the cure for cancer. And we're really fortunate in Frederick County to have the National Cancer Institute here and the National Institute of Health because we really are trying to do good things in our community, both in our jobs and elsewhere. And I want to thank people who raise money for that cure. And I wanted to really acknowledge our career firefighters, Local 3666, who every year raise money for the Patty Hurwitz Fund by selling t-shirts. And we're very pleased that they do that. I know the town of Thurmont and the town of Middletown also are involved. And there's many other ways and many other organizations and activities that are out there trying to support the cure for cancer. So they all deserve our support. Cancer has pretty much touched every family that I know, including my own. So there's much to consider and much to be aware of concerning breast cancer. I hope today's discussion shared something you didn't know and helped to make you aware of what's happening in our community and how you can prevent and take charge of your health. Thank you for joining us for Frederick at its Best, and this is Frederick at its Best.